2, 1, go.
Hello there. My name is Alex Seaman and I'm Senior Veterinary Surgeon at the Donkey Sanctuary in England. So it's fantastic to be asked to talk to you today, and thanks Julie for the invite. I'm really looking forward to getting to know some of you through your questions when we have an online Q&A session. Just thought I'd kick off by showing you my sort of journey, if you like. I started my love of donkeys as a little girl. So here I am on the left of the picture with the ponytails and my great aunt Winifred. So this is Jenny, our donkey that used to come to church and deliver the Palm Sunday crosses. We had 2 donkeys and they've been a massive inspiration to me and have directed my work. So I hope that by the end of the talk, you'll know a little bit more about donkeys and will also be really enjoying your time with them. We've got a few aims. I'd like you to, at the end of the talk, to be able to understand why we look after donkeys the way we do and understand about their health care, recognise good and then following on from that, recognise poor health in the donkey, and find out information and support for donkeys. You'll notice as we go through the talk, we find there are some links to various things on our own website, which I'd like to share with you. Ben, who's introduced me, has made a lovely point about the picture at the top of this donkey being fed with a carrot. You can't see, but it actually has been sliced in half because we don't want to choke this little donkey by feeding him a whole carrot down there. So that's a sort of a trick photograph for everybody here. So when we think about donkeys, if you're a child drawing a donkey as opposed to a horse, the one thing that you would draw differently is their huge great ears, and that's what everybody recognises a donkey by, its ears. And the ears are this window into the fact they come from a semi-arid environment. It's hot, they have to lose heat through these big ears. There isn't an awful lot of food around, so they have to bray over a very long distance to try and keep up with their friends and find out where they are. So the resources that are in short supply, the 3 F's, if you like, are food, fluids, and friends. And if you can remember those 3 facts about donkeys, it tells you a huge amount about their physiology, about what goes wrong really when we put them in the wrong type of environment, and the needs they have that are different from the horse. So food, fluids, and friends. They are a fairly desert adapted species in their physiology and lifestyle. I'd also like to just make the point here that their behaviour is different from that of a horse. So they can't run as fast as a horse. They are a prey species. So this little donkey here has been attacked by a hyena. The hyena has taken out half of his hindquarters, and this is what donkeys are always wary of. So in their own mind, they're going to try and hide the signs of being unwell so they don't get picked off by the predator. And we need to be very clever to work out what's wrong with the donkey, because they're naturally going to be trying to hide those behaviours. We need to pick up on fairly subtle cues that they're giving us. And we also need to remember that because they're not such a quick flight animal, if you're working with a donkey and it wants you to not do something, it has a tendency perhaps to squash you against a fence, and you need to be quite careful with the way that you approach working with donkeys. They have a need for friendship. They won't have big harem groups where they come from, and they're often pair bonded. So we like to bring them in even to hospital with their friends. We will even walk them into the operating knockdown box with a friend. It provides them with comfort and support, and they will often react much better with that friend present. Ben did some lovely work for us, Ben Hart, who I'm sure you've met before, and Ben has also done this lovely webinar, The Answer to Common Donkey Behaviour Problems, which I'm not going to go into much detail because Ben's done this fantastic webinar for you. But I think what's quite interesting is that we tend to call these things problems, because we say the donkey has a behaviour problem. And really we should change our mindset. The donkey is showing completely normal adaptive behaviours to a bad experience. And a lot of donkeys that come to us have had bad experiences and have behaviour, quote, problems. So we need to be thinking about how donkeys learn, about how to work with them, with their particularly cautious and sensitive natures, so that we get the best out of our donkeys. So when you've done this webinar and you've had a cup of tea, I'd urge you all to go away and listen to the YouTube video with Ben explaining in great detail about how donkeys work. So we said we were going to look at the fact donkeys come from these resource poor environments, and the first thing on my list was food. So food is in short supply in an arid environment, and donkeys have to be very careful to use their food wisely, and their bodies are designed to do this. So several years ago, we thought donkeys could be fed about 3/4 of the amount of a pony of the same size, and we did that as our feeding guide, and donkeys got fat. And so we invested quite a lot of money in a research project, and we looked at what donkeys actually do need to survive and keep a good body weight, and it's even less than 75% of a pony. So if we look at, for example, the digestible energy requirements of a donkey in summer, we've got 88 kilojoules of digestible energy per kilogram compared to a pony of 157 and even 3/4 of 117. So we can see there's a lot less in a donkey, which unfortunately means that to satisfy their need, they should only be fed quite small amounts of their body weight as dry matter, 1.3 to 1.8%, which unfortunately for the donkey, when it's fed the wrong type of thing, is far less than a pony. So we feed them high fiber diets, such as the straw illustrated on the right-hand side here. So the summary of that is that donkeys need far fewer calories to achieve the desirable body weight than a pony. They have what is called a thrifty genotype, so they are adapted to get the most out of the food that is around them. And unfortunately for the donkey, it requires 54% less in the summer and only 26% less in the winter, which means if you're co-grazing a donkey and a pony on the same grass, then your donkey is probably going to get into trouble, as we'll see in a minute. So what tends to happen is that donkeys, particularly in England, are used as companion animals and to graze these lovely lush pastures that you can see in front of you. And although it looks really idyllic, the donkey is going to be getting a high amount of soluble sugars from the grasses. It hasn't got to chew very hard, and it will rapidly get to be severely obese, such as this poor donkey here on the right-hand side. And obesity carries with it a number of really significant physiological risks for any species, particularly in the donkey, the risk of a hypoglycemic episode. The insulin will be unregulated. As we know in people, when they become very obese, we have the same insulin dysregulation. And then we get into what can be called a metabolic syndrome, which in horses is equine metabolic syndrome, or in donkeys it's very similar. We call it asinine metabolic syndrome. The extra weight will cause hoof disease and more problems we'll look at later. And clearly these big heavy donkeys are going to stress their joints. So lots and lots of things that a poor diet, too high in calories, is going to lead to in donkeys, because they come from areas where it isn't common to have lots of food. How can we manage their weight? And I think this is a challenge for all of us who own donkeys and look after donkeys, particularly in temperate climates, that we have to restrict their grazing. And you can obviously do this with electric fences, or you can put them on sand paddocks, which has additional problems, or perhaps wood chip areas, or just a plain menage. When they're on these very restricted areas and they're on these very high fiber diets, you are going to find problems perhaps over a long period of time with the amount of trace elements and vitamins they're getting. So you may need to add a balancer to the diet. So we have some commercial companies that we've worked with that make micronutrient balancers for donkeys to supplement them when they're on these diets. The other thing that can happen, of course, is that they get bored, and boredom will lead to very poor behaviours. So we have, again, I've got the link up here for you, a really lovely link that Ben, who I've previously mentioned, created. This is a sort of owner work through all the things you can do. And we will try to make our donkeys have a good time, even though they're restricted in their feeding, by, for example, giving them logs to chew, or hiding things like carrots on strings or in wood, or scattered around the place. You can have a lot of fun trying to make your donkey's environment enriched so they don't get bored. Clearly, exercising donkeys is a great idea. It's a problem if they've become fat and have already got foot problems, but you should be trying to get out there and do fun things with your donkeys, perhaps driving them, taking them for walks, and if they are really up to it, then you can do lots of fun things with your donkeys, obstacle courses, etc. If the donkey's failing to lose weight, then we'll have a little look later at something called equine metabolic syndrome testing. So we might have to actually see what else we can do from a veterinary point of view to try and help get them to a normal body condition. So If we think about the normal healthy donkey, I think there's been an awful lot of sort of misunderstanding of donkey behaviour, partly due to the Winnie the Pooh books, which A.A. Milne wrote, where Eeyore is portrayed as kind of sad character who lives on his own and is fairly melancholic. And that has become people's view of a donkey to many of us, and particularly because we also see donkeys working very hard in countries where they're a beast of burden. They have this sort of image of an animal that is depressed and dull. And actually, a donkey, I'd really like you to switch to more of the companion in Shrek, where I think we all know this little donkey here is happy, he's in your face, he's cheerful, he's hungry, and he's busy and he's inquisitive. And that's what a normal donkey should be. And you need to know your donkey's behaviour, and especially with your young animals, they should be full of excitement and full of life. So the first line here, bright, alert, responsive, or BAR is veterinary shorthand for that. Your donkey should be cheerful and active, and you should know its behaviour. We want your donkey to have a very good appetite, and we want to see coming out the other end lots of piles of normal faeces at regular intervals throughout the day. We want to see our donkey walking happily, not lying down for too long. They're a prey species, as we've said, so they should be up and about, on their feet most of the time, unless they're having a small bout of sleeping with maybe a friend keeping guard. We shouldn't have discharges from the eyes or the nose or from the back end. We should have a normal temperature, pulse and respiration. So we should get to know our normal donkeys, because without that, we can't recognise the sick donkey. So we've got Jo here on the left examining a donkey. She's giving a really good hands-on check. And I think it's important that we know how to examine our donkey and what to do to start with. So I have one of the best jobs in the world, because I get paid to actually stand and look at donkeys, and I can truthfully, hand on heart, say this is necessary, because I need to know if that donkey is exhibiting normal behaviours, if he's eating normally, chewing, swallowing, moving around happily, his ears are mobile. So spend some time watching the donkey. Once you've done that, and while you're doing that, you can also check his respiratory rate. So you want to watch the number of times the rib cage inflates and deflates, or the nostrils flare and unflare, and count that over a minute or over a half minute and multiply by 2. You'll see that the donkey reference range is a little bit higher than a horse. They're not generally fit like a racehorse, and their lung capacity is slightly smaller. So their average respiratory rate, normally on a day in our country, sort of about 16 to 20. On a hot day when they're trying to have pant and lose heat, it might go up a little bit. Pulse, you can take the pulse if you're an owner from a couple of places, and the easiest is to get used to resting your hand under the donkey's chin and feeling for the big mandibular artery that's going round the back of the mandible there, and learning to count the number of beats there that are happening in 30 seconds, multiplying by 2. Your vet will probably do that, and also listen to the stethoscope just behind the donkey's left elbow. Again, you'll notice that the reference range for a donkey is slightly higher than a horse. Especially a fit, conditioned horse will have a lowish heart rate, maybe even down to the sort of mid-20s to 30s, whereas a donkey, we would expect the reference range for a heart to start at about 30, 36, and maybe go up even to about 44 for our normal donkey, or perhaps on a hot day up to 50. Temperature range, unfortunately, does mean taking the temperature with a rectal thermometer. It's a good idea to get your donkey used to being handled around the tail area, just gently tail tickling around the dock, so he starts to find that a pleasant experience. And the donkey normal body temperature here, we use Celsius. If you're more familiar with working in Fahrenheit, I've put both of them there. And again, it's a slightly different temperature there from the horse, which has just this slightly shifted to the right, slightly higher temperature range. So have those normal donkey values put somewhere in your tack room, just so you know what's normal when you do talk to your vet. One thing that people really need to do on a regular basis, because of the problem of donkeys putting on too much weight, is body condition scoring and estimating weight. So there are various things you've got to be really mindful of here. I mean, I've given you two extremes here. You've got one donkey that's clearly extremely thin. You can see every rib and you can see its spine. So that's not a problem. And on the right-hand side, you've got this really fat donkey with rolls of fat accumulating like a camel along its back and its neck. and it's all on its body. So those are kind of the extremes, but quite often people look from a distance. It's got a thick hair coat, they think the donkey's all right, and actually get in there and really feel it, and it can be quite thin, especially in our own climate in the winter. So weight estimation and condition scoring is quite challenging. We have some normograms which you can look at on our website. So again, there's a link here which will use a weigh scale tape measure around the donkey's heart girth and also the distance from its elbow to its hip, and then we can use those to give an estimation of weight. And this is useful if you've got to do a procedure that's involving giving medication. But for most owners, what you're wanting to do is chart whether the donkey is in an okay body condition or needs to lose or gain a bit. So for that, we have a body donkey condition score chart. And again, I've given you some kind of easy examples here of the thin, the fat, and the just right donkey. But if you take some time later on or download this condition score and read through it, we need to look at a number of areas. So we should be feeling the neck, we should be feeling the bones of the neck, the muscle, we should be putting our hands over the withers, we should be running our hands along the rib and the belly, over the back, feeling for the backbone, and over the hindquarters. And with practice, you can start getting very good at body condition scoring. It will get more difficult in an older animal because some of the fat crests that have accumulated, for example, on the neck might not completely go away, and they will often develop quite a sort of sagged back appearance. But it is something that's well worth doing, and we're aiming to keep our donkeys at a condition score 3, which is our ideal donkey. It's got a good cover of muscle. You can feel the ribs with gentle pressure, and they've got some nice sort of quarters there to give them strength behind. So now you know what a sort of healthy donkey should look like. How about the sick donkey or even the emergency case? And I think reading from the bottom upwards, we all know what's emergent. We know that it's really important to call the vet if the donkey's not weight bearing, if it's got a potential fracture, if the eye's incredibly painful, if it's got colic, if it's foaling. But what most people aren't so good at, and what we spend a lot of time talking to other vets about, is that any donkey that's gone off its feed or any donkey that's dull is a real priority. Of course, going back to the beginning of our talk, donkeys try to hide painful behaviours because they're always thinking of the hyena in the background. So these two sort of highlighted in red, the dull and anorexic donkey, are actually real emergencies. And the reason for that is something called hyperlipemia or hyperlipidemia, which you may have come across. And if you do already feel comfortable with this, that's great. But for a lot of people, it's a little bit confusing. But in essence, when a donkey gets very sick, they tend to reduce their appetite. I don't know how you feel about being very stressed. I sometimes reach for chocolate. Sometimes if I've got an exam coming up, all I want is black coffee. We all respond differently to stress. Donkeys, as a rule, when they're very stressed or unwell, they stop eating. And that's why, again, you need to stand and watch them to see if they're actually eating and chewing. Once they've stopped eating, they then got a poor source of glucose to keep the brain and vital organs going. So what does the body do? It sucks fat out the system to try and provide energy. Unfortunately, so many donkeys have got excess fat that this excess fat overwhelms the liver that should process it, overwhelms the vital organs, and you get this really nasty condition where multi-organ failure occurs. It's quite a complex metabolic disease. There's a lot of hormonal pathways that we won't go into, but the bottom line is that this disease, if it's not treated or recognised quickly, actually has a really high fatality rate. So if your donkey is dull and it isn't eating, we need to act upon it. And talking about donkeys and the environment they live in, once they're obese and they have these very high insulin levels that go with obesity, this also really acts against some of the hormonal pathways in the hyperlipemia chain of events and makes it very difficult to pull them round. I put a slide here of a pregnant donkey because pregnant donkeys and lactating jennies have extremely high energy demands. So even if they are eating a bit, they can still become hyperlipemic if their diet isn't correctly managed for a pregnant animal as opposed to a resting animal. So what does a donkey with hyperlipemia look like? Well, we've said they're dull and depressed, and often this is the only thing you'll notice is that maybe they've taken themselves away from the herd, maybe they just haven't gone to their feed that morning, maybe they're lying down. It's just something not quite right. And I think the owner that has spent time and knows their donkey can pick up on this. They sometimes pretend to eat, so they will sort of try to please you, put their nose in a bucket, won't really eat. Tachycardia, high heart rate. Tachypnea, high respiratory rate. Look at their gums, they can be quite congested, not that nice salmon pink, but maybe becoming quite dark, maybe even purple. If you do listen to the guts, you'll find they're very slow. And if they do pass feces, they will have dry sort of feces covered in mucus, because they've taken a long time to pass through the gastrointestinal tract. If we take a blood sample, vets will find that we've got this milky appearance as the fat starts to separate out. So of the 3 blood samples there, on the right-hand side, we've got one that's got this layer of fat starting to build up on top of the red cells. So that's why it's looking kind of milky. And you can imagine that going round in your system is going to clog up all the little capillaries that feed your vital organs. We might also have a really horrible smell to the breath. So there's halitosis, this wobbliness, the ataxia. Run your hand underneath, there's a pitting edema, and there's a pyrexia, so the temperature goes up as all the organs start to fail. So clinically, we see an animal that's just starting to not eat with a little bit of a high pulse and maybe a high temperature, rapidly becoming a very sick animal. So we have to remember then that dull donkeys are a priority. So what have we got here? We've got this little donkey here that's actually got a really nasty colic. If this donkey was a horse, with the type of colic he had, which I remember this donkey had a pelvic flexure infection, he'd be rolling around on the ground, legs in the air, groaning, kicking at his stomach. This donkey, as an experienced donkey practitioner, I can tell you it's in a lot of pain. His head is below the withers, his ears are back, he has a facial grimace, he's got tight nostrils, tight muzzle, and tight muscles around the eyes. But it doesn't look that much. You could sort of walk past and not notice. If you didn't see that his friend's actually listening to something, his ears are alert, you then start to see the difference. So this animal needs to be seen very quickly. And again, unfortunately, any animal with colic, because it's not eating, rapidly becomes a candidate for getting hyperlipemia. And something that maybe not all vets are very confident with, but we try and encourage, is that donkeys can be rectally examined safely by most vets. We can give them drugs to relax the muscles of the rectum to make it easier, and we can get a lot of information. And we should also look at the other end, look at the donkey's mouth and see what's going on there. So a dull donkey, if you remember nothing else from this half hour, is a real priority, should be seen promptly and investigated fully. So what sort of treatment do we need for these cases? Well, we've said that there's not enough energy going in, so we need to reverse that. We need to quickly get food on board. We can do this with a nasogastric or a stomach tube. So Vicky here is stomach tubing this donkey with a mixture of water, glucose, electrolyte and gruel. If the little donkey doesn't have gut sounds and is starting to get even more sick, we're going to need to bring the donkey into hospital, and we're going to need to give it intravenous fluids. The donkeys are often quite uncomfortable, they're going to need pain relief, and they may also be developing gastric ulceration because of the lack of food going in, so they need medication for that. As owners, I think dedicated nursing care is so important. Donkeys will really respond to a dedicated caregiver in this case, who is bringing them the type of food they're used to having, the special treats that they like. So you have a really strong role to play in nursing your donkey if it does get sick. So we've looked at how the donkey needs to be managed from a sort of food point of view, what happens when they get too fat, how we try to monitor that, and how we recognise a healthy donkey and what we do if they're a sick donkey, acutely sick. I'd now like to just spend some time looking at the other husbandry measures you need for good health and welfare for your donkey. So we're going to look at dentistry, farriery, why you might want to do a health screen annually, and some of the things that people aren't so good at, certainly in our country, getting donkeys castrated, vaccinated, and parasites controlled. Dentistry. Now, this is a big subject, isn't it? And what's really disappointing is that lots of donkeys that come into our care haven't had dental treatment, not even, for a year or so. and lots of things can go wrong. As they get older, much as in ourselves, when we get older, the mouth can get quite problematic. We have a grading scale of 1 to 5, with 1 being a really good mouth that's got no problems, 5 being a mouth that's non-functional. And as these donkeys get older, their mouths start to get grade 4 and 5 because a lot of them haven't been treated adequately throughout their life. In our country, we have operators who should have done the equine dental technician training, which has been accredited by the British Association of Equine Dentistry and the British Equine Veterinary Association. But sadly, we do find that people have a bit of a go themselves in donkeys' mouths and often don't do a very good job, or else do a very aggressive job. So dentistry is very important. And statistics that we've developed show that when donkey dental care is not good, it tends to suggest that owners have also not done other things very well, such as got their donkeys vaccinated or looked at their worming history. And unfortunately, donkeys that have got poor mouths, because of the problems that go with that, they don't necessarily survive as long as they should. So we have within our team a really talented lady, Gemma Lilly, who has looked at donkey's teeth for years and was the president of the British Association of Equine Dental Technicians. And she's also created a webinar all about why you should bother looking at donkey's teeth. So I'm not going to spend a huge amount of time talking about it, but I just want to signpost you to that really good webinar on donkey's teeth. Just for a very simple point of view, your annual dental visit will help prevent colic and hyperlipemia. Both of those are really expensive conditions to treat if you call a vet, and really not very nice for the donkey's welfare. If you get the donkey's teeth looked at preventively, we will avoid those conditions. So here Gemma's got a lovely setup. We've got a set of stocks here. She's got a really good headlight and visibility. She's got a mirror. And the donkey's quite happy here. He's not sedated. He's got a full mouth gag and he's having his teeth looked at. And most of our donkeys tolerate dentistry really well using motorized tools without sedation. Why is dental disease neglected so often in donkeys? And I think it's this really sort of combination of things. They're not ridden, so we don't have people worrying about creating bit teeth and taking out wolf teeth and all the sort of things that horsey people say. And so owners don't really recognise that teeth are incredibly important just for grinding that long fibre that they need to keep a good body condition. Because donkeys are often being fed too much, they can maintain this good body condition, so they can be quite fat if they're feeding grass, even though they've got hideous ulcers in their teeth and on their gums and really quite poor teeth. So the food that we're giving them is often wrong, so we miss the dental disease. Joe here is doing an examination of the donkey's mouth externally, and you can gain a lot of information if you know what you're doing. You can palpate the side of the dental arcade, you can feel under the mandible, you can percuss the sinuses. There's a lot of information that you can get. But if you don't put a full mouth speculum in, you're never really going to pick up some of the hidden things. So sorry about the gory picture at the bottom of your screen, but here we have a donkey mouth, lower jaw that's been looked at post-mortem, and we have a lot of food that's got packed in what's called a diastema, a gap between two teeth. And you can imagine that the donkey can't pick that out. We've got rotting food causing gum decay, eating back the enamel and the cementum, and going into the nerve supply and causing the donkey considerable amount of pain. Little donkey on the right here has actually got a fractured tooth that's pointing in towards the tongue. You can't find that out if you don't look in the mouth of the gag. As an owner, one thing you can do is look at the donkey's feces, as we mentioned before. And if you've got, for example, whole grain coming straight through, long fibre coming straight through, you know that what's going in at one end isn't really being chewed and digested. So you should be seeing fairly short fibres coming through in your donkey's feces, really no more than about ½ centimetre. And if you look at that feces and you see lots of long fibre coming through, get the dentist in. So another area of considerable neglect in donkeys is hoof disease. We find that people relinquish donkeys to us that they haven't called the farrier to for a long time. And that's a pity really, because you end up with something like this where the donkey's feet have been neglected for a number of years perhaps, and they've grown very long, they haven't been trimmed, and the donkey's starting to walk off the heels, stretch all the flexor tendons, and get curling up at the toe. Hoof disease is very strongly linked to the management of the donkey, and also to the systemic health of the animal. And donkey hooves are a little bit different from that of the horse, and farriers don't always feel quite comfortable with looking at donkey feet, but certainly we spend a lot of time going to farrier schools and trying to educate farriers about donkeys, and they normally quite enjoy working with them as a species after that. So if you remember right at the beginning, donkeys with these big ears coming from semi-arid environment. What is there not much of? Food. What do? Put them on pasture with lots of food, so they have obesity and high insulin. What else is there not much of? Fluid. So what are you going to do to keep the moisture in your hoof? You're going to have a hoof that's good at taking up moisture because it needs to do it, because it's not normally got much of it. Unfortunately, you put a donkey in a climate like the United Kingdom, where we have, well, we've had sort of rain pretty much every day since September, I think, at the moment. Donkeys' feet are getting really wet at the moment. They're taking up more moisture than they should. And so we're seeing a lot of seedy toe, brush, and then things like white line abscesses because the hoof wall is getting degraded. Small bits of gravel are getting stuck at the white line area, working their way up. So you've got a picture in the middle there of a sort of classic white line seedy toe type infection where a mixed fungal bacterial growth is eating away the keratinized laminae between the sensitive laminae and the hoof wall. That all needs to be cut away. We have a donkey on the right that's been allowed to sort of walk around with severe pain in its feet, and its shoulder muscles have wasted, and it's really not comfortable at all. And on the left, we have an X-ray of a donkey foot that I'm sure even without expert training, you can see that the last bone of those three is in a really strange angle. Instead of being parallel to the other two, it's dropped away and it's been distorted there. So that's sort of a foot of a donkey that's had neglected laminitis for years. So we've got these big fat animals, we've got hooves that take up more moisture, we've got people that aren't riding the donkeys, so we're not noticing that they're lame, and we're getting quite serious problems here. One other thing at the bottom there, which we will come back to, is that not everyone even vaccinates their donkeys regularly against tetanus. And clearly, if you've got an animal that's predisposed to getting an abscess in its hoof and it's walking around where there's lots of the clostridial organisms such as feces, it is going to have a high risk of tetanus. So a slide here which we'll just sort of talk through a little bit slowly, but one of the big problems that we see a huge amount of is laminitis in donkeys. So laminitis has got lots of different causal factors. So some of the easiest things in the middle there, you're a donkey or a native breed pony, you're designed to gain weight and you're designed to put on food that's thrifty genotype. You have naturally a high insulin level, because that's the hormone that promotes food gain. You tend to put on weight, so there we are, that's your regional obesity, and you often don't have an awful lot of exercise. So I think those things are quite straightforward. We tend to put them out at pasture, so we're getting this extra fat accumulation. As these animals get very fat, we get these abnormal inflammatory cytokines. All of these things feed through to an animal that's very prone to laminitis. PPID, pars pituitary intermedia dysfunction, we'll come to in a minute. That's a disorder of the pituitary gland. So lots of factors basically act on the insulin pathway that then acts on the foot to cause laminitis. Some of the triggers that, from a simple point of view that we've mentioned, the weight, the insulin, the inflammatory cytokines, ends up with these really sad looking little donkey feet here. Focusing on the right hand picture here. So the donkey's got laminitic rings that you might have been familiar with. So at the toe region, the circulation has been badly affected and we've got very little growth going on, very tight growth rings. Little bit better circulation at the heels, so the growth rings are a bit wider, but classically you get these divergent growth rings in a donkey with laminitis. And if we look at a split foot, which I'm afraid is rather gory, we can again see that the pedal bone, which is the last one sitting inside the hoof there, is an abnormal shape. It's become pointed and slippered. It's not sitting parallel to that nice black hoof wall, and it's sitting in a load of inflammatory debris there rather than nice tight laminae. The donkey hoof is a bit different from the horse. The radiograph on the right is there certainly to help vets interpret donkey radiographs. We expect a donkey to have up to 10 millimeters or so of the second phalanx within the hoof wall, whereas in the horse, the extensor process of the distal phalanx is level with the coronary band. There's a little bit of a difference with interpreting radiographs, and we're always really happy to talk to vets and share that information. But it just means interpreting donkey radiographs is a little bit different, and how we manage some of the effects of laminitis from a veterinary point of view is a little bit different from a horse. For example, we don't like to use heart bar shoes because the frog tissue in the donkey doesn't extend as far forward under the pedal bone. So we have to be a little bit different in how we manage laminitis and how we diagnose it from the radiograph. So we did mention in our list of husbandry things that we need to do are necessity perhaps for an annual blood test looking for metabolic syndrome and PPID. Starting at the bottom, I think it's a really good idea to have a blood test on your donkey on a reasonably regular basis because of this delayed recognition of disease, because of this subtlety in behaviour. If the donkey's been conditioned well, that shouldn't be a problem for the donkey to have that. It should be an acceptable procedure. And donkeys do have different normal reference ranges from horses. So again, our website will link you or your vet through to the normal reference ranges. You can overinterpret certain conditions if you compare a donkey blood to a horse blood, as they have got different species normals. Pars pituitary intermediate dysfunction is a disorder of the pituitary gland seen in the older animal, where we start to get a loss of regulation of the pituitary, and they start to increase more of a hormone called adrenocorticotropic hormone, which again acts via an insulin pathway to cause laminitis. This is a disease which we can now recognise and treat. Equine or asinine metabolic syndrome we've referred to a few times, and this is basically a disease that's very largely related to management of the animal becoming obese. But there are things we can do about it from a veterinary point of view. We can diagnose it using certain testing protocols, and there is medication to help with managing it. So looking at the pars pituitary intermediate dysfunction, we have this hormone that's secreted from the pituitary gland. It tends to happen more in the older animals, so we think over 15 is generally when it starts. Higher levels are linked to an increase in laminitis. The hormone itself is also immunosuppressive and has a number of other things related to things such as increasing melatonin, so the animals don't necessarily recognise day length as well, and will have these rather longer and exaggerated hairy coats as they have loose lack of control of seasonality. Nowadays, we can certainly test and treat PPID animals, and again, we have donkey reference ranges available, and there is a product specifically licensed for use in equines that can be used to treat this condition. So, working our way through some of the other things that are necessary for donkey good health and welfare, I find this is a bit depressing. When I'm asked to castrate this type of stallion, it always makes my heart sink a little bit. He's a super mature stallion. He's got really large testicles. We know the surgery for him is going to be a big deal. And we think, why didn't somebody get this done as a youngster when it would have been easy? There's a lot of overproduction of unwanted donkeys. Most of the equine charities in this country are overflowing with unwanted equines. Irresponsible breeding is a bad thing. So we would like to encourage owners to get donkeys castrated as youngsters, where it can be done in their own stable environment, and there's fewer complications. So just a little audit that we did ourselves a few years ago. In one particular season, we had 65 donkeys that we castrated, equal numbers really of youngsters under 2 and the mature donkeys. But look what happens if you're a young animal, you're castrated, no complications. You knock them down in their own home environment, small surgical procedure, up and about, minimal aftercare. The donkey has a really good life. You get to the mature animal, what's that? Almost 1 in 3 of what these animals ended up with a complication, which it could have been an infection, severe swelling, hemorrhage. maybe even necessitating coming back into the operating theatre. So these animals have got large testicles, a lot of fat supply in the area with big blood vessels, and their behaviours are very learnt, so it can be quite difficult to integrate back again to a group with mares or geldings. So please, if you are somebody who has a pet donkey and you decide to, or you've gone and bought a young donkey, please, for its own benefit, try and get it castrated as a youngster. It's a much better procedure for the donkey when it's done young. Vaccination. So in the UK, we've recently had an outbreak, if you like, of equine influenza that caused us to cancel racing for some time. And we have been incredibly vigilant now within our own herd of ensuring that donkeys are vaccinated extremely regularly, even more regularly than previously. And what we found was been disappointing that throughout the United Kingdom, a lot of owners of horses and donkeys don't really understand the need for vaccinations. They don't get the idea of herd immunity. So if most of the population takes the trouble to vaccinate their animals, then there is very low risk for everybody. So it's a really a good thing to do. People also don't understand how sick donkeys can get when they get diseases such as equine influenza or equine herpes virus. Not only does it make them get the high temperature, the runny nose, the cough, what have we also said about donkeys that get stressed and get sick and get high temperatures? The next thing is that they go off their feed. The next thing is that they get hyperlipemia. So you end up with a donkey that's got a huge number of problems from a disease that was quite straightforward and preventable. I think for those of you who don't know, there's been a massive outbreak of influenza across some of Africa recently, which has wiped out upwards of 30,000 donkeys as they've been travelling across West Africa. So a really susceptible breed to influenza. Tetanus, again, protection should be mandatory in my view. It's a really cheap vaccination, really simple, primary course and then biannual. Protects against what is a life-threatening disease that is incredibly difficult to treat a donkey once they have tetanus. Parasites. So donkeys, like horses, are subject to a lot of intestinal parasites. And we find that people, again, aren't necessarily very up to speed, and all the topics we've mentioned today could be standalone talks for an hour, but briefly, there are a lot of parasites that live within the donkey's internal organs. The most common are the small strongyles. So we have a little, the small strongyles are the ones that cause most of the damage, I think, at the moment in our country. We see a significant amount of liver fluke because we have quite wet pastures. I'm not sure if that would be the same in Australia. I don't expect you have the same problem with liver fluke, but for us it is significant. I've highlighted in red lungworm because lungworm is a very well adapted parasite to the donkey. So you've got lungworms there in the picture. In the donkey, they will reach adulthood in the lungs, and they will also pass as adults, egg-laying adults, out the feces. So you will be able to detect eggs in the feces of donkeys that have lungworm, so we can test for that. Unfortunately, if a horse gets infected with lungworm, it isn't very well host adapted to the horse. It creates an incredibly inflammatory reaction in the horse's lungs, and the parasite can't reach maturity. But it means that donkeys, if they're not treated correctly for lungworm, can act as a source of a really nasty infection for horses. So that's why people in the past have been quite not keen to graze a donkey and a horse together. And if you do choose to do that, you must make sure that you test your donkey regularly for lungworm and treat it correctly against lungworm if it's present, and isolate it from the horse during that period of time. We can also see tapeworms in donkeys. Ascarids, again, I've highlighted in red because in horses we always regard ascarids as a disease of the juvenile. So generally by an animal is up to 2 years old, it will develop an immune response and ascarids won't be found in the feces. Donkeys don't seem to have the ability to mount such a strong immune response, and we will sometimes even see ascarids in adult animals. So we should be really mindful of all the parasites that donkeys can have, and we should be working them on an evidence-based protocol. I'm not going to give you a protocol because no one size fits all donkeys. It depends on your grazing management, the age of your animal, and the other animals present. So you need to create a program with your vet. But again, we can help with you individually, or we can help your vet to create those worming programs. So, for example, the small sciathostomes, which we just mentioned, the first one there, it's an interesting parasite because they tend to lie dormant in the colon for a large period of time and then emerge suddenly. And when they emerge, they can create a really sick animal if they emerge en masse. And I'll just put the picture here of this little donkey because this donkey is very sick with sciathostomes, and it's actually, if this was a horse, it would have a huge amount of diarrhea and worms pouring out of it. Why is it not happening with the donkey? Do we remember that it came from an area where fluid is in short supply? So the donkey is trying to hang on to the fluid. Its colon is more adapted to absorb water. They don't show diarrhea as often, but instead it has a ventral edema. So that very square appearance to its abdomen is actually fluid that's sort of leaked out of the circulation, and the donkey is actually quite sick with edema, but not with diarrhea. So these cases with these emerging sciathostomes are real emergency cases for donkeys. I'm going to put down ectoparasites before we finish because we get a lot of people that have donkeys with skin conditions, and they often feel that it's something quite donkey specific. But unfortunately, having worked with donkeys for 20 years as a vet, and I've been a donkey owner for a lot longer than that, I would encourage you to just think really about the donkey skin as an organ that needs to be completely correctly sort of worked up and diagnosed and followed through. So there isn't really a specific disease of donkey skin, but you need to look particularly carefully at your donkey to find the problem. So for us, our major problem is ectoparasites with lice. And so we have a very nice product, which is the tea tree spray, that helps us to reduce the lice population. If you have a donkey with a skin disease, you're going to need to ask your vet to help you work through it in a logical and systematic fashion. There isn't a particular donkey skin disease, although their skin is a little bit different from the horse. The diseases that affect them are very similar. I'm going to finish this webinar on just signposting you to a resource that's available on the Donkey Sanctuary website. So if you click on the link here, it will direct you to a number of areas. We have some resources. The Clinical Companion of the Donkey is a free to download book, or you can also send off it as a hard copy. And this covers health examination and most of the disease in quite a lot of detail that we've briefly looked at in this 30-minute chat. We have another one that's come out very recently, which is the Clinical Companion of the Donkey Dentistry. So this has a lot of detail about dental issues in donkeys. And if you go to the website, you'll also find a lot of other resources there in terms of fact sheets, nutritional advice, Ben Hart with his behaviour advice, and resources for professionals working overseas with regards to harness, etc. And we're continuing to add more things onto our site almost daily. So I'd like to say, to finish by saying thank you for listening. I know it's been a bit of a whistle-stop tour, but hopefully you're going to come back to me with some questions and we'll have a good time chatting through the answers when we do that. Thank you.